Okay. Good morning, good afternoon, good evening. My name is Vijay Jagannathan. I'm Secretary General of CityNet, and it gives me great pleasure to welcome all of you. I think there are 200 of you who have registered for this webinar, which is being done jointly with INHAF. And the president of INHAF, Mr. Kirti Shah, is also a very active member of CityNet. So we are delighted that we can do it jointly with INHAF. What the discussion today is going to be on reflections on COVID-19, on what the data reveals by Dr. Anjum Altaf. Dr. Anjum Altaf has had a distinguished career in the World Bank before he returned to Pakistan, and there he was the dean of the Lahore University Management School, which is the equivalent of the IIMs in India. And he and I also worked together quite a lot in the Philippines during our World Bank days. So it's a great pleasure that we are having him to talk about what the data reveals on COVID-19. And the reason why this is quite significant is that this particular webinar is the third in our series. The first one was when we presented the case of Seoul on how they successfully tackled COVID-19. The second seminar, which was held 2 weeks ago, had case studies from Colombo and from Iloilo City in the Philippines. And I see Mayor Rosy Senanayake there, welcome. We had actually your Chief Medical Officer make a very impressive presentation on how Colombo has been able to manage the COVID situation so well. And we had a similar case also from Iloilo City. But today is a more depressing case because we are looking at South Asia, where the two giant countries, India and Pakistan, have not really had that much success. And Dr. Altaf has been analyzing the data, and I'm sure he's going to give us some interesting insights on what has happened and what are the lessons we can learn from that. So we will be having, after Dr. Altaf's presentation of about 15 minutes, we'd like to have our three panelists give their, their reactions on his presentation and their insights on how this complicated topic could be better handled. We would have the mayor of Colombo, Mayor Senanayake. The second would be Sanjay Sridhar, whom also I see on the screen. Sanjay used to be the regional director of C40 for South Asia region. So he has extensive experience in India, Pakistan, and in several other countries in the Middle East for which he was responsible. He also is one of the alumni from the famous architecture school in Ahmedabad. So I'm sure there's some connections with Kirti on that. And the third panelist is the one many of us know quite well, but I don't see her on the screen, Mary Jane Ortega, who used to be the mayor of San Fernando, La Union province in the Philippines, and now is a special advisor to CityNet. So without any further ado, let me pass the floor on to Kirti, who will give a few minutes introduction on INHAF, and then over to Anjum for his presentation. Over to you, Kirti.
Hello, can you hear me?
Yes.
Hello, do you hear me? Hello.
We can hear you well. Please go ahead.
Okay. No, I'm not a panelist, and I'm essentially, I think, welcoming as a host, and also presenting a context of the webinar series that we are organized. And I'm also going to kind of present to the context within which this webinar series and the other work we are doing that comes to you. First, welcome you all to this incidentally also the third webinar for a series of 30 webinars that we are organizing. And I'm very delighted that we have such a distinguished panel to make presentation. I also feel very privileged that we have CityNet as a partner. I've been associated with CityNet for the last 25 years, have been very active, believe in it, and believe in its role in Asia, which is witnessing one of the most significant drama in the urbanization field. I want to kind of give you very quickly the context, the Indian urban context within which we are looking at this whole thing. As you know, cities are future in India as anywhere else. 35% of the people live in the cities already, but in 30 more years, we would have something like 50% of the people living in cities. Cities also are engines of economic growth. Anywhere between 65% to 68% of GDP is produced in the cities. And in no time, we would see 75% of the GDP being produced in our cities. Cities also are centers of learning, technology, culture, arts, innovation, and also, as you saw during this COVID, large resort of people trying to escape grinding poverty. So this is the one aspect of the city that we know. There's also a second aspect of our cities, and that is this, that our cities do not seem to be in very good health. Something is not right in the way we plan them, way we manage them, and the way we develop them. And I just wanted to kind of give very quick 3 examples so that I don't have to kind of take too much of time explaining what the problems are. Delhi is the political capital of India, and its air is so polluted that the courts once sometimes said it's a gas chamber. Mumbai is the wealth capital of India, and more than half of its people live in slums. Varanasi is the spiritual and the religious capital of the country, and we have our Ganga Maya so polluted, we require special ministry to deal with it. This is the ongoing existing problem. We also must look at the future. We look at the macro perspective. We are getting ready to absorb something like 840 million people by 2050. We require something like $640 trillion in 20 years' time in order to kind of look after our infrastructure development. We are talking about we need to create something like 1 million jobs a month in order to look after 800 million people who are below the age of 35. And we need to restructure our economy because 90% of our jobs are in the informal sector. Therefore, in the context of future challenges, in the context of problems that we already have, we've got to think about cities afresh. And we essentially have developed a terminology I'll just mention. We're talking about economically productive, politically participatory, culturally vibrant, socially just, environmentally sustainable, technologically adaptive, and people-centric cities. Now, the series of webinars that we organize, we are trying to take this challenge to people. We're trying to say that this challenge alone could not be left to government to handle. Society must participate meaningfully. Professionals must come in, business must come in, industry must come in, and civil society must play a big role in reconceiving, rethinking on our cities. And we believe that urban issues are so complex that we feel that a large number of webinars like this, and we at the moment are talking about 30, would allow us a scope to present these challenges to people and try and find resources from society to deal with them. So that is the kind of challenge we are trying to press, and that is the context in which these webinars are organized. Thank you very much for participation. Thank you very much for partnering with us. With those introductory words, I'll hand over to Dr. Anjum to make his presentations. Thank you, Dr. Anjum.
Thank you, Kirti, and thank you, Vijay. I missed what you might have said as an introduction to the talk, but I'll go ahead anyway. What I decided to do was to reverse the sequence of the talk because I felt that, you know, if I presented the India-Pakistan comparison, a lot of data questions would arise in people's minds. And also because this webinar is focused on data, I thought it would be better if I started with the data questions and said what I want to say about them before I went to the presentation. So that's the way I'm going to start. Radhika, if you can show the first slide. I want to make about 6 points about the data. The first one is that most comparisons, especially cross-country ones, are not useful. And the reason for that is that the two key indicators that are being used, the cases and the deaths, are both non-standardized. So cases depend completely on the numbers tested, which vary tremendously all over the place. And deaths also depend on how deaths are being recorded, to what extent COVID deaths are being separated from non-COVID deaths, how many deaths are taking place in hospitals and how many outside. And also there is a tremendous controversy about undercounting. So both those variables are problematic. In addition to that, there are a lot of confounding variables. For example, simply the time lag. If the infection has started 4 weeks earlier in some place compared to another, the numbers would, you know, not be comparable. Then in addition to that, variations across countries in age pyramids, in weather, in institutional arrangements, in the quality of healthcare. There's so many confounding variables that those numbers don't mean anything, and unfortunately they are just taking up a lot of discussion time. So my first point is that those kinds of comparisons are not useful, with some exceptions where the variations are so stark. For example, if you take Vietnam, where it's reported that there have been no deaths, then certainly to start thinking in terms of, well, what happened in Vietnam that didn't happen elsewhere. So if you could go to the next slide, please. Some inferences are useful from the experience that we had so far. The first is in mortality profile, it's pretty clear that the disproportionate number of deaths are occurring amongst the older population, those with comorbidity. It's also very clear that masks help. To some extent, that very different strategies have led to different results. Something that I have not added here, I want to say, is that it's also fairly clear now that lockdowns are not a cure, and also that the majority of carriers are asymptomatic. I think all these inferences hold across the experience of COVID. Next slide, please. So my recommendation is to focus simply on the local, forgetting about, you know, how India is comparing with Sweden or whatever. Just focus on local. Even within countries, just focus on, if you are in Delhi, just focus, you know, if you are in charge of people who are in charge of the response in Delhi, should focus on Delhi. And there, I think a number of indicators are useful. First, excess deaths. I'm a strong advocate of monitoring excess deaths. These are not very difficult to do. Just if one could just sample the crematoria and burial places that are being under the charge of the municipality, they would give a fairly good indication of how serious the COVID crisis is. Countries have been, in India, Pakistan, been very slow to pick up on this, but whatever reports I'm hearing are that the official figures are a tremendous undercount. The number of deaths being reported in in the months of May and June are way higher than what the norm was last year. And here I would also, something I've not mentioned here, I would also want the tracking of COVID deaths versus non-COVID deaths, because I feel that unfortunately this debate got very much influenced by its characterization of lives versus livelihoods, which sort of oriented it towards a choice between lockdown and opening up. Whereas in my estimation, given the kinds of populations that are present in India and South Asia, given the poverty levels, it is really a case of lives versus lives, not lives versus livelihoods. So it's a question of how many people will die of COVID and how many people will die of non-COVID related health issues that did not get proper attention because of the lockdowns. So I would want that to be looked at carefully. Next slide, please. The next point is about density. A lot was made of the fact that the infection transmit much more rapidly where the densities are high. That's undoubtedly that is true. I mean, the more people there are, the more there is a chance of contact, so the more there is a chance of the disease spreading. But density is not everything. I think some of the evidence that is coming in shows that living conditions matter a lot. For example, Manhattan is very dense, but the living conditions there are not such where you can have, very rapid spread of the epidemic. And some, I'm not very familiar with India. I've just read secondary data. There's a study I read that looked at density in the wards in Mumbai and showed that the ward that has the highest density is the C ward, which is somewhere around the Marine Drive. It's 2.5 times as dense as the other wards that are problematic, the GN, I think, which has a lot of chawls, and the GS, which has Dharavi in it. So the point is that in South Asia, we automatically sort of subconsciously associate density with slums. But that need not be the case. You can have dense living without slums. So living conditions matter a lot, and that, I think, Kirti would appreciate that has significant implications for urban policy. So it's not just density, it's how people live. Okay. So, the next slide, please. The last point I want to make is, what I've termed dubious data. There is a lot of emphasis on normalizing the cases of deaths over the national population. So using an indicator like death per million, and I claim that is methodologically incorrect. Just to take a very broad cut at it, the major concentration of the coronavirus has been in a few of the large metros. So over half the cases are maybe in 5 of the Indian metros and about 3 of the Pakistani metros. So to use the entire population of the country to get a comforting statistic like death per million, I think is not warranted. Just yesterday in the Hindu, I read this big headline saying, Health Ministry says India has the lowest, one of the lowest death per lakh incidences in the entire world. I think, that gives a false comfort, because, that's methodologically incorrect. And I'll try and show it with an illustration. why that might be the case. So if you could go to the next slide, please. Okay, here I've tried to show, just to illustrate by using the analogy of transmission with a burn rate. If you can look at the big square and the small square, think of them as forests. The small square is about 1 hectare forest and the big square is 100 hectare forest. And imagine that the only difference is in the area. Everything else is exactly the same. So it's the same weather, the same wind speed, the same kind of trees, the same vegetation, etc. Now, if you look at the dot in the middle, if you start a fire over there, then the fire in the two forests is going to burn exactly at the same rate. The fact that this is a bigger fire doesn't mean that bigger forest doesn't mean that the fire will burn any slower. So what the transmission is analogous to the burn rate, and so that is what matters. At what speed is the infection being transmitted? That's what we have to look at. Of course, at the end, when it's all over, there'll be a lot more trees down in the big forest than in the small forest. That's just a function of the size. But to say after one day that, oh, you lost, 1 tree out of 100 and we lost 1 tree out of 1,000, so we are doing much better, is flawed. It doesn't make any sense. There are some other aspects to it. So if you look at the second small square, where I have put in 2 dots. So if you start the fire at 2 places at the same time, of course, it will burn much faster. And this aspect of the virus has generally been ignored, what people call seeding. So if you think of the places where the virus spread very, very rapidly, like New York or the places in Italy or Wuhan. I mean, in New York, the lockdown was announced somewhere in March, but the infections have started coming in almost at the end of December. So the number of tourists who passed through New York in one day probably exceeds the entire number of tourists that come to Pakistan in 1 year. So there were a lot more infected carriers there before the lockdown was instituted. So this seeding, that's why it burned so very rapidly. Whereas, if you have only one place where the fire starts, it burns, of course, slower. In the third square, I have put in an oval, and there, what I'm trying to illustrate is that if you have in that forest certain very dry patches, if you have dry tinder somewhere, then of course the fire, when it gets there, it will rip through it at a much faster pace. And these tinder boxes in cities like New York and Stockholm were the old people's homes, the institutionalized, where a lot of old people were concentrated. In fact, the statistics from Sweden show that more than half the deaths have been from old people's homes. So in South Asia, we don't have that. So that's a big difference. But one has to keep in mind why the transmission might be faster or slower in some places than the others. Now in the big square, I've shown these 2 concentric circles, and this is trying to illustrate the impact of interventions. So if the fire starts and as a measure of intervention, you log out, you knock down all the trees in this concentric circle, it can prevent the fire from jumping from the inner circle to outside the bigger circle. So it's kind of a lockdown strategy. You lock down the virus within the small circle and prevent it from jumping to the outer circle. But what I want to note here is that this lockdown doesn't prevent the fire from burning inside the small circle. It will still, absent any other intervention, it will still burn through the entire smaller circle. So the lockdown is not a cure. A lockdown can prevent this, slow down this, it can prevent the spread to other areas, so slow down the overall number of transmissions. It can give time for preparation, but it's not a cure. The other analogy that I want to use just to illustrate the same point is to now not to think of this as a forest, but as a community, and this small circle is a man-eating tiger that has entered this community. The first reaction is, of course, all to hide inside the homes and lock yourself up. No, please go to the previous slide. So, I mean, the tiger is still there. You know, you can stay inside your lockdown as long as you want. Ultimately, you have to come out. So the remedy is to neutralize the tiger. It is to get rid of the virus, and the virus cannot be gotten rid of through a lockdown. There you need, I mean, either you get a vaccine, or you have a fire extinguisher that can extinguish the fire, you get a vaccine, or you allow it to run all the way through and burn everything to get to herd immunity, which in a country like India or Pakistan is a very large number. Or you find an intervention that neutralizes that virus, which is simply the, the 4T, track, trace, test, and treat. That is the only way to neutralize the virus. The lockdown it gives you time to do it, but the lockdown by itself will not get rid of the virus. I mean, as we saw in the inferences, over half the people are
my apologies, we are doing this across many oceans, so I think that we've had a bit of a problem with Dr. Altaf's microphone right now. So what I propose is, because he was nearing the end of his presentation, we could hear from our three panelists, and maybe at the end he can come back and... Oh, Anjum, are you back? We can't hear you. I see him back on the screen.
Yeah, I'm back.
Okay, go ahead. Please go ahead.
Okay. Now on the India-Pakistan comparison, despite what I said in the very beginning that cross-country comparisons are not very helpful, I think that in this case, this is as close as we can get to a natural experiment, because most of the confounding variables, get washed out. The age pyramids are the same, the level of development, the kind of healthcare facilities, the low investment in public health, the fact that most of the population has had the BCG injections, that they have been exposed to malaria, whatever factors people are citing as differences between populations are kind of washed out over here. So it's not perfect, but it's fairly close to, a natural experiment. The innovation that I have made in this comparison of lockdowns between India and Pakistan is to break the lockdown into two broad components. The first is the closure of facilities where large people can gather, like colleges, stadiums, marriage halls, shopping malls, schools, etc. And that's, that part of the lockdown made a lot of sense, because in this particular virus, there is a lot of evidence that they can be super spreaders. That one person can affect, 50 or 60, as happened in the church in South Korea or in the choir in Washington. So that made a lot of sense. The other part of the lockdown is the stay-at-home measure, where people were asked to stay at home for an extended period of time. Now, the first part, the closure of facilities, is common to both India and Pakistan, but the stay-at-home is almost like a 0-1. I mean, it was, from what I hear and read, it was very stringent in India, and it was completely absent in Pakistan. So one can try and assess how much difference did this stay-at-home measure make in the outcomes. So if you could go to the next slide. Arif, could you go to the next slide, please? Okay, so now here are the COVID deaths in India and Pakistan, and this is almost till yesterday. You can see that what I want to just point out is that the general pattern is the same. There's both an upward trend in both. One would have expected, given the very stringent stay-at-home in India, and the fact that most other factors are biased in favor of India, in the sense that health facilities are better, the IT companies are better, the pharma industry is better. One would have expected that the lack of a stay-at-home, which was completely absent in Pakistan, would have shown up in worse statistics. Now, even if you adjust these deaths for undercounts, etc., it can shift the Pakistan curve upwards, but it doesn't change the reality that the lockdown and the very stringent stay-at-home did not get for India what it got for a lot of other countries that implemented the lockdown, which is the flattening of the curve, let alone a reversal of it. Both India and Pakistan are still recording the highest number of cases and deaths every day. So, in a sense, the lockdown is being relaxed when the virus is almost, is still peaking. It's nowhere close to getting to a flat state. So that was the point I wanted to make. That it seems from this evidence that the stay-at-home did not get much result from, although it involved a very high cost in India than it did. And in Pakistan, it was not a conscious decision not to have the stay-at-home. The stay-at-home was announced, but the authorities were completely unable to enforce it. And also because here we had a very strong religious lobby, and because it was a month of Ramadan, they wanted to have congregational prayers. The government yielded to that. They yielded again for the Eid holidays, allowing Eid shopping, etc. And there was no restriction on transport. I mean, public transport was not available, but one could travel within cities, one could travel between cities. So what people did, if you had a private vehicle, you could pretty much go everywhere. So what people did, they just rented private vehicles, and because the per person cost would be lowered if you packed them in, they were even more densely packed than they would have been otherwise. So that's the point that I wanted to show with this. Now the question is, why did India not benefit from the lockdown in the way that the other countries have benefited, where everywhere the curve has started to come down where they have implemented the lockdown. So my read on that is that the first is that intervention, no matter how beneficial it is in theory, I mean, you can show that the stay-at-home, if implemented well, can yield excellent results. But if it is not feasible, then it's pretty much a waste of time. And in my opinion, it was not feasible in India and Pakistan simply because the majority of the population survives on what they earn every day, and they need income to buy essential items that they need, like medicines for other problems. So if you want to have stay at home, you have to both first arrange to get meals to the people at their doorstep. You need to get income into their accounts so that they can go out and buy essential medicines or other essential stuff. Then you have to go into each home and test and find out who is infected. You isolate those and you quarantine those that are not. If you don't do that step, then, you know, we have very large multi-generational households, 8, 10 people living. There's no way to have physical distancing. There's no way to have self-quarantine. It was simply not a feasible measure, and that is why it is showing very few results. Also, I feel that the lockdown measure was copied in haste, especially the stay-at-home. You know, as I said, the first part made a lot of sense, the closure of colleges, etc. And I'm sure it slowed down the transmission. The best model in India is put out by the Indian scientists for COVID response. It's a large group, I think 500 or so scientists. And that's the only model that has all its assumptions available for public scrutiny, all their numbers, and they show that in India, the number of deaths averted from the 40-day lockdown was between 18,000 and 32,000 at the upper limit. And that's a very small gain given the price. I mean, if one saw the migrant workers going back to their villages, that's a huge, huge price. So I feel that the lockdown was copied in haste from other countries where the seeding was much higher and the virus was spreading extremely rapidly. There was nothing else that could be done except, you know, hitting the brakes hard in an emergency. But then, you know, going to the other measures that were needed, the tracking, tracing, testing, and treating, afforded by the time that was available, given by the lockdown. So I feel that both countries fell into the trap of thinking that a very stringent and an extended lockdown was a cure for the virus. I mean, as I said, from the inference, it was obvious that this was not the case. This could never be the case. The lockdown just afforded time to prepare, and it seems from whatever data is available that the countries that prioritize the 4T, the testing, the tracking, tracing, testing, and treating, did a lot better than countries that relied just on the lockdown. And it should have been quite obvious that the lockdown could not be continued, indefinitely, simply because the majority of the population in South Asia does not have the savings to survive without income. They have to work, find some, unless, you know, there are welfare systems that support them. So, and that is now becoming obvious when the lockdown is having to be relaxed when the cases are still peaking, which, you know, it doesn't make any sense. So the question now is that since one has to come out of a lockdown cannot continue indefinitely, what is to be done? Some people are suggesting staggered lockdowns, lockdown for phase, coming out, going back into a lockdown. Some people are suggesting staggered work arrangements. So you work. That something I saw in the EPW last week made some very good suggestions. Said this is being tried being implemented in the Caribbean. That's Dr. Avinash Prasad's column. said that instead of, being lured into this false dichotomy of lockdown and opening up, one should focus very differently. One should focus on identifying who are the safe groups in the population versus those who are at risk. And he has suggested two measures. One is, of course, age-related, and the other is for comorbidities, just obesity. And so you screen and you separate out the safe people from the people who are at risk. Then you identify the activities that are safe versus those that are risky. And then you identify the safe ways of pursuing those activities versus risky ways. And you need to get the safe people doing safe things in safe ways and protecting the ones that are at risk, so that the danger to them is minimized, and with the sole objective now of minimizing the number of deaths. So I think that that suggests a good way of thinking for how we are going to exit the lockdown, especially when both countries are exiting the lockdown, where without actually having flattened the curve or reversed it, and the numbers are still peaking. I personally, I don't feel there's a lot of talk about the peak being, mid-September or mid-November. I don't see that at all, because I don't see any intervention whatsoever that would flatten these curves or turn them back. I think that we are almost at the situation where, barring the closure of facilities that slowed down the virus, undoubtedly, the super spreader events where those are possible. But aside from that, we are in a kind of a do-nothing scenario where it will just get to herd immunity and then it will stop. So I'll stop there.
Thank you, Anjum. That was a very good exposition of the challenges we are facing in India and Pakistan. Now, let me get straight off to our very distinguished panelists to talk, to give their reactions. And the first panelist whom I'd like to invite is Mayor Rosy Senanayake of Colombo City. For those of you who may not be aware, Colombo has had a remarkable success in controlling COVID. And this has been due to, of course, the leadership of her worship, the mayor, who's very dynamic and active member of CityNet. So may I request you to give us your words of wisdom, please, Mayor.
Thank you very much, Dr. Vijay. It's nice seeing you. I mean, technology has made it possible for us to get together and at least share our experiences and knowledge and thoughts and research. Thank you, Dr. Vijay, for keeping us all going. Let me also just give a brief on, at the outset, I must say that this is an excellent study. Whilst congratulating the author, Professor Anjum Altaf, I would like to add in a few peer facts based on my own COVID control experience from the Sri Lankan perspective. Unlike in India and Pakistan, in Sri Lanka, both the closure of facilities at home was implemented simultaneously on the same day. It was imposed for the very first time in the history of Lanka and was called island-wide quarantine curfew. In contrast to India and Pakistan, arrangements were made to supply essential goods, medicines, and food to the doorstep of people during quarantine curfew. In Sri Lanka, what made the difference was its very strong public health infrastructure, where medical officers and public health inspectors who know their geographical area and its people were placed at the grassroots level to control the COVID outbreak in the city and the country. With regards to risk communication, as Professor Anjum Altaf has pointed out, it is of paramount importance that the enforcement orders are uniform in character, unique, and are issued from one entity. In Sri Lanka, it was a joint COVID-19 task force appointed by His Excellency the President, headed by the Director General of Health Services, the Army Command, and the Chief of Police. All the directives originated and issued from that center. It is very important to remember that the number of COVID deaths are correlated with other numerous factors, such as the age structure of the population at risk and other chronic diseases such as diabetes, hypertension, heart disease, respiratory illnesses, etc., among the population that is exposed to this virus. Therefore, comparing just the number of COVID deaths in both countries without taking other contributory factors into account is very tricky and may result in drawing wrong conclusions. Also, when mortality of COVID-19 is discussed, I would like to share with you other contributory factors which played a major role in achieving very low COVID cases. Actually, the COVID cases in Sri Lanka up to now is 1,950, and we have only had 11 deaths in Sri Lanka. So the other related areas, if I may include, is like number one would be immediate and mandatory hospitalization of the positive cases, vigorous contact tracing, hospitalization of the first line symptomatic contacts and to subject them to compulsory PCR tests, self-quarantine of all exposed first line contacts, random PCR testing among the lockdown communities to ascertain if there is community transmission, provision of dry ration to the families of the lockdown areas to maintain their nutrition status, creating awareness and health promotion among vulnerable communities, promotion of public health preventive measures such as social distancing, hand washing, sanitizing. And finally, the lockdown of entire communities of the country is only one important component and not the only one that is preventing COVID deaths. In our experience, timely lockdown of the country together with implementation of other public health measures have resulted in very low incident rates and very low COVID mortality rates. Hence, I suggest that it would be more appropriate if those aspects are also taken into consideration when discussing and comparing mortality and determining on a success or a failure of a particular policy, which in this study is the lockdown policy of both countries. It is noted that the last COVID death count that was taken for this research was on the 24th of May, which was nearly 2 months ago. It is worthwhile to revisit the current mortality statistics and to validate if the conclusion drawn in this study is still valid. Thank you very much.
Thank you very much. And it's really impressive that when you compare with other countries of South Asia, Sri Lanka has blazed ahead. Congratulations, Mayor, for your leadership also.
Thank you very much, Dr. Vijay.
And now let me turn to Mayor Mary Jean Ortega. She used to be the mayor of San Fernando, La Union, and now is a special advisor to CityNet. Over to you, Mary Jean. You're still muted. Radhika, can you unmute her, please?
Unmute. Can you hear me now?
Yes, we can hear you well.
All right. Yeah, so hello, Vijay. I'm glad to see you again for the third time for this third webinar. And I'm glad to see Kurti. Hi, Kurti. It's good to see you. And it was interesting listening to Dr. Anjum Altaf. One of the things that came to my mind while listening is also when I heard Mayor Rosy of Colombo say that they had one, it came from the national. As soon as we had the COVID, there were these guidelines from the national. I agree, in the Philippines, we also had that. There were very stringent rules and guidelines at the very start for the lockdown last March 16. But I would just like to say that no one size fits all. At the start, perhaps that's good. So you come up with a general rule. But like in La Union, in the city of San Fernando, we have had, in San Fernando, we have had no deaths. In the province of La Union, we have had 4, during the first month. We have had 0 deaths for the past 2 months, but we are still treated in the same manner as in other places where you have COVID cases. I like what Dr. Anjum Altaf said, that you know, it's like treating a forest fire. So you should go and treat the forest fires, but there should be another treatment for the places where you don't have forest fires. And this is where, as we can see, it is important to have capacitated leaders in the local level, like Mayor Rosy. While you may have good ones in the national, you have to have good ones also on the local. So this is more on decentralization, so that approaching the COVID cases should also now be decentralized, and we need capacitated and good leaders for that. For example, on the lockdown, I agree with Dr. Altaf, it's not a cure, but definitely it prevents. But for how long? We should be able to determine it on the ground, not on a faraway office. On density, I agree that I was really worried. I said, what happens now to this urban trend that says that we should have dense, you know, urban planning? Before we started with bungalows and having spread out development. And now you come up with this big condominiums. And so we say we should go dense. And so I said, is it now right to go dense? But as Dr. Altaf said, it's not just density. It should also be according to the quality of life in that particular area. So I like those inputs very much, but I have to use another term again that we heard from the Prime Minister of New Zealand, and we're now using, that we have to have that bubble. We have to take care of the people within our bubble and use what we now have in our new normal dictionary. We should have social distancing. We should always wash hands. Problem. How about in places where they can't even afford to have water and not even have soap? So this is where living conditions come in. And the good habits that we have seen, like for example, in Korea and in Japan, they're very strict in using masks. Even before COVID, they were already wearing masks. When they go to their houses, they wear slippers. They don't bring in the shoes that they used outside. So these are the small habits that probably we have to follow. And I like the basic thing that we need data. We have to have the proper data, and we have to study it and analyze it within our context. So congratulations, Vijay, for bringing these webinars and bringing very good speakers and different insights. Thank you.
Observations you have.
Okay.
Sanjay has to be unmuted.
Thank you, Vijay. Can you hear me now?
Yes.
Thank you, Vijay. Thank you for having me here. And Mary Jane, it's good to see you again. Last we met was in Yokohama a couple of years ago. Dr. Altaf, it's a pleasure to meet you the first time. And Your Excellency, Mayor of Colombo, I've heard great things about you and the work you've done from very dear friends who work in the Urban Development Department in Colombo. So congratulations on a tough job that you're doing really,
Thank you,
really
Sanjay.
well. So in terms of, I will try and take a slightly different trajectory to this discussion, and I will try and bring in what has been the impact of COVID on cities in India. And I've been in touch with, for example, Wasim Akhtar Saab, the mayor of Karachi. I've been in touch with mayor of Dhaka North and Dhaka South. because these are cities like Lahore, like Karachi, like Mumbai. These are cities that are dense, 20, 30 million people living in urban agglomerations. And the first reflection that and after hearing everything that all of you have said, COVID has largely been restricted only to urban areas, largely, which has been an indication of where the population is moving from rural to urban. So people have gone from bigger towns, from bigger cities to bigger towns to smaller towns. They haven't actually gone back to the villages because the impact has been largely restricted, even though there have been cases of COVID infections in some rural areas of the country, but it's very few. So that's one indicator as to where the demographic distribution is moving as a country, number one. And that also relates to the point that Dr. Altaf was making on density and the quality of urban living in the cities in this part of the world. The other interesting inference that I draw from the COVID lockdown and the implementation, and as I said, everybody have their opinions on what could have been done better, but I'm just looking at it from the perspective of the way things have been rolled out. And one of the big things that stood out to me is the role of the civil service. In India, the political class have largely been kept out of the implementation of COVID measures, in the sense that there is a strong directive from national government, and it is the chief secretary of the state who is the single point of coordination for everything that happens in the state, and then it flows down to the different departments and the administrative officers take over. So the political class have largely been kept out of this. Yes, they have a role to play in terms of there are ministers in charge for each district in the state, but they are not in charge of the implementation. It is still down to the IAS officers, the Indian Administrative Service. You have similar ones in Pakistan and Bangladesh as well. Perhaps this is an indication of how the lack of devolution of power in this part of the country, this part of the world, has actually played a role in the coordination between different levels of government. Because if we had empowered mayors, like the case in Dhaka, we would have had a very different story in terms of how the implementation would have been rolled out. Here, it's very clearly chief secretary, commissioner of the municipal corporation. It ends there. And with the commissioner, you have all the different departments coming under him or her who's in charge. The other couple of impacts and kind of reflections on what the COVID lockdown has revealed is a huge deficiency on our lack of focus on education and the education system. Because basically with exams ruled out because of COVID, the education system is learning a bitter truth. And that is, it never focused on learning as an opportunity to be given to all. Instead, it relied on exclusion to mask its limited offering to a few. And this should really prompt a reflection and an honest reset as to how education is approached across the country, because this is really a big revolution in the sense that even if people are able to log in, I mean, I have two sons and they're able to join their classes online. But what about the poor in rural schools who follow the same syllabus? They're not able to afford a laptop and a steady internet connection to be able to log in and continue the syllabus. So there is a stark disconnect and a dichotomy in terms of what the education system is doing. And I also believe that anybody who wants to learn should be able to learn. We need to figure out how to make that happen. The large gains in informed citizenship, as well as a productive workforce participation, can only come about from this engagement at all levels. Otherwise, 50 years from now, we will still be in the bottom third of nations who don't have their education system up to the mark. And the other key reflection for me was similar to Pakistan and also Bangladesh. These three countries have been fairly slow to get drugs to their patients, mostly because our regulatory system is slow. And even in a pandemic situation, we can't get the system to move fast enough. But pre-existing drugs could help. Since they are already available, they might be locally produced and won't be bottlenecked by the government and the regulatory systems for approval of newer drugs that are coming into the market to treat the pandemic. The other reflection was about migrant labor, and this has been the biggest impact of the COVID in India, at least, because the poorest of the poor have been the most impacted. And the least polluters have again been the most impacted, in the sense that people who had moved from the towns to the cities, who would not use their private cars, who had no access to a formal wages, and they worked on construction sites. They've been the most seriously impacted people. But also, I think there is a serious case for a relook on how to manage the informal economy, which is embedded in every aspect of the formal economy. And even if you open up, I think the biggest realization is you might open up the construction industry, but there are no laborers to come and work on the sites because all the laborers have left. The bigger cities have gone back home, or they are stuck somewhere in between. So even opening up the formal economy, the informal labor force is just not there for the economy to function. And therefore, the informal economy has been largely mismanaged. And I think it's the biggest kind of reflection from my end. But there are also some positives coming out of this. I don't want to paint a one-sided picture. There have been some successes. The city that I come from, Bangalore, has actually done a fairly decent job. There are things that we're learning every day, and I've been closely following and helping the city corporation in ways that we can. But Dr. Altaf, one of the Bangalore models, and the success of the Bangalore models is a different version of the 4 T's, which is tracing, testing, technology, and transparency. What they have done well is they did a really good job during the 55 or 57 days of lockdown, is to do a really door-to-door survey of where is the origin of the infection. So they were able to trace patients 1 through 282. I think the numbers are growing, but they're growing at about 100 infections or 100 people getting infected per day, which is significantly manageable from a city's perspective. The second one is testing. They've done a very, very good job of getting the private hospitals on board, setting up fever clinics at a ward level. We have 198 wards in the city. The city has a population of 14 million people. So it's a fairly large city. And the third T is about technology. They've really used technology, and I will give credit to the city corporation for using technology to have real-time data available across all departments who are involved in the implementation of the COVID, and bringing that interdepartmental coordination between the health department to the transportation to water and waste. Because if you seal down an entire neighborhood, you have to remove the waste, you have to make sure that your electricity is running, and those are all the basic minimum utilities required for people to stay locked down. Otherwise, people are really going to go up in arms if they really don't have the basic necessities. The fourth T is transparency. I think cities that did not disclose their infection numbers and try to subdue them are really kind of paying the price now, because those numbers are 3x or almost 4 times the numbers that are actually getting reported in terms of resources required to be deployed. So Bangalore did a good job in terms of making sure that those numbers were reported honestly, and it's not just the deaths that were reported, but even the infection rate, the number of people getting infected per day. So as I said, the 4 T's were tracing, testing, technology, and transparency, which has really helped Bangalore put in place a system that will be now tested, because our infection rates are definitely growing. We have community transmission now at the city level, but it is largely restricted to 3 or 4 zones that are now being sealed as of yesterday. So those zones are completely sealed, while the other zones are growing at maybe 5 or 10 people per day getting infected. But in these 4 zones, the infection rates are much higher, but at least there's a history of what they know what to do. They know where to go. They know what kind of resources need to be deployed and what kind of utilities need to be provided. And lastly, I will say that the lockdown has also revealed that we can have cleaner air. We can, have streets without much traffic and congestion and demand for private vehicle usage. But what is really an eye-opener is, in order for us to do all of this, we don't have to shut down the entire economy. It is possible for us to do this, but if it takes a country like India to shut down an entire economy to clean up its air, that cannot be an option. There has to be a way for us to be able to say, how can we provide cleaner air? How can we provide better water? How can we provide better urban living for our citizens in our cities? And this is where I think what we do as we open up is really important. For example, I'll end this by giving just a few examples of some of the things that we could be doing and some of the things that we are not doing. For example, during the opening up from the lockdown, streets that were locked down because of the COVID, people have gotten used to walking in those streets. Right? There is a case to be made that because social distancing is required, people need wider footpaths, wider sidewalks. So take a lane from the street and make it an extension of the footpath as a temporary measure, so that people who are used to driving on narrower streets, because they were cordoned off because of barriers, they will continue to drive on narrower streets. People get more space to walk, keeping the social distancing norms that are required to manage the infection, number one. Secondly, all the big employers, Microsoft, and Bangalore is the IT capital of the country. We have huge technology parks that have large companies employing 50,000, 60,000 people in those campuses. There is a case to renegotiate with those big employers on having a large percentage of their staff to continue to be permanently work from home, at least 50% of their time that they work, because that will change the travel demand, that will change the congestion on the street, that will change behavioral habits of how people commute in the city. That has a direct impact on economy. So let me stop there, and I'm happy to answer any questions, but this has been a really fruitful discussion with all of you. Thank you.
Thank you, Sanjay. That was a very good summary of not only the problems, but also some of the opportunities. Now, we have some time for a discussion, and I propose that we go over by 15 minutes so that, there's a chance to for some of the participants to ask questions and for our panelists and the speaker to respond. Let me start with Dato Mahmood of Seberang Perai, Malaysia. And he's asking if we could discuss sectors that were most negatively and positively impacted by the pandemic. And I think Sanjay gave some very useful insights on that. The fact that the leveraging the technology, the fact that we have begun to realize the importance of clean air, on the fact that pedestrianization is no longer politically as risky as people might have thought of earlier. So let me turn to Mayor Senanayake. What do you think about it? Do you think that Colombo, for example, can really make a difference in terms of traffic management and you know, the general sort of quality of air and water and everything, taking advantage of the experience you've had with COVID?
Dr. Vijay, things are never going to be the same after COVID-19. Post-COVID has actually changed the mindsets and attitudes of people. People are very cautious. People have been more disciplined, and you know, I mean, there are loads of factors in where people have changed their lifestyles as well. It is a little too soon for me to predict or come to a conclusion to say that we could, you know, better manage traffic and all the other services that we provide. To me, it is yet very soon, because we have just opened up a couple of weeks ago and we're doing it stage by stage. And we are of course managing the city quite well, because we managed the city during COVID. I must say our public health department, like I said, they chose the PHIs plus the central government together supporting us. Practically every department in the council, commissioner, whether it was solid waste, whether it was drainage, whether it was the traffic department, whether it was the charity department, you know, looking after the underserved communities with regards to their, you know, needs, from dry ration to, like you said, you know, clean drinking water, to the other essential services were provided without any hindrance. There were no stumbling blocks or breakages. The city was clean. We continued to keep the city clean. We continued to keep give the citizens the services that we gave them, in spite of, you know, having a total lockdown and curfew. I must say they worked tirelessly, and I was amazed to see the commitment of the people that were working and giving the services, in spite of, you know, their lives being at risk, that they came out to support the city. And that was one of the reasons to why we were able to minimize, because Colombo only reported 130 cases and we only had 2 deaths. And since May 2nd, we have not had a single case reported, because we've been able to immediately lock down, you know, basically do contact tracing first, second, fourth, doing PCR testing together with, you know, the support of the central government, and also providing the necessary services. And now we've opened up and we are gradually coming back to normalcy, but it is not normal anymore. I mean, you know, people are looking at things like social distancing, you know, hand washing, sanitizing, and also, you know, taking precautions while getting out there and doing your job or getting back to work. While saying all that, you know, managing traffic, or, you know, perhaps talking about the other necessary infrastructure that has to be provided for the city, I must say we have also had a huge downward trend with regards to the economy, because the people in the underserved communities are daily waged people. You know, a lot of them were without any means of any income as far as their livelihoods were concerned for almost 3 months. And even getting back to, you know, jobs or getting back to their normal, you know, day-to-day lives have changed. And it is a huge strain on the city and also on the people. So we're gradually trying to get back to normalcy. So I'm hoping that, you know, in the next couple of months, things are never going to be the same. It's going to take a while for us to pick up and, you know, get back to normalcy. I'm hoping that in the next couple of months that we would be able to get back into act. We would be able to revive our economy. The president has been very, very firm right at this point of time with regards to a stimulus package, putting cash in, you know, the woman's hand, because there's a huge, 1 in every 3rd household is headed by a woman. So the female-headed household rates are very high, and their livelihoods are at risk. So these are some of the things that we need to rethink and rework on, and especially in the city, taking care of the underserved community is going to be a bit of a challenge.
Thank you very much, Mayor. Now, I have a few other questions. Let me request Dr. Altaf to answer these, and then others are most welcome to send in their comments or questions, and we'll try and accommodate as many as we can. 2 questions, Anjum. One is from Ms. Nilima Prabhu, who's from the University of Mumbai. And she's asking, what measures do you think India should adopt to start normalizing, especially the schools and colleges? And the second question is from Kaustubh Das. And he asks that in the case of India, it was clear that cases shot up once the lockdown was lifted and people started to go back to work. Can you comment on this, please? So these are the two questions for you. Anjum.
Okay. Vijay, I think the first question I already hinted at in my talk, how to come out of the lockdown. You have to identify the people who are least at risk and what are the safe activities and how to do them in safe ways. I think that there is still a great opportunity in incentivizing, putting in some incentivizing measures like happened in the US with the OSHA regulations, safety and health regulations, so that you can incentivize institutions to become COVID ready. And if they pass some kind of a COVID ready screening, they could get their workforce back. So this would require having workbenches at a certain distance, having their public toilets, having soap for hand washing, all those kinds of things. And then the people could come back on a staggered basis. There are a number of staggered re-entry schemes that have been proposed, some based on virology, some based on just straightforward, like if you have a school, you can have a 2-day-a-week stagger, one third of the students going to school for 2 days and then rotating them like that so that you can maintain the safe distancing. So those are the kind of measures that are needed to open up schools, colleges, etc. Cases having shot up, I mean, this was only to be expected, as I mentioned earlier, that the lockdown is not a cure. The minute you lift the lockdown, people start going up and the fire starts again. You have the same reproduction rate, one person infecting more than one person, the cases are bound to shoot up. The graph that I had shown for Pakistan, you could see a distinct kink at about May 20. So that was the time when people came back from the Eid holidays and the 10-day lag had passed when the infections we start showing symptoms. So you can't have it clearer than that you ease the lockup and you don't have the other measures in place, the cases are bound to shoot up again. So if I could, Vijay, use this opportunity to say a few things about some of the points that were raised by the discussants, if you would allow.
Please go ahead.
Can I go ahead? Okay.
Yeah, please.
Okay. In response to the mayor, I would say immediately that the one reason that I didn't make it a cross South Asia comparison or didn't put Sri Lanka into it was because of all the factors that she had mentioned. They make the comparison virtually, useless. The kind of public health infrastructure that they have, the local administration, the strength of the local administration. So I restricted it to where I thought that the similarities were very great between India and Pakistan. So that was one point I wanted to make. And on just a technical point on the graph, the version that I had circulated was quite some time back, that's up to 24th May, but if you see the graph today that I have in the slide, it's up to June 22. The trend is very much the same. To Mary Jane, yes, the local leadership is extremely important, and that has been weak. Both the public health infrastructure and the local leadership has been weak in India and Pakistan. So, and to Sanjay, I would make 2 points. He's absolutely right about Bangalore, and that is what I'd hinted, that the cities or places that have prioritized the 40s have done better than those who have relied on the lockdown. But one point that I think is very important, and I would like to flag it, is that Sanjay said that the virus is restricted to the big cities, and it's not there, or very little of there is in the rural areas. I would like to flag this because there is no difference between the people in the rural areas and in the urban areas. There's some minor differences, they are further apart, but this is just the danger in an exponential growth, that it stays flat for a very long time and then it starts to kink up. And because there has been a time lag, it has gone back with the migrant workers. So small towns in Bihar and so will start catching up. You'll have local peaks there 4 months from now or 3 months from now, when the cases will start peaking there. And we have to be very, very careful because the health facilities there, the testing there is much, much weaker. And we'll have to find a way of dealing with it. It's better to be prepared now than to be caught by surprise.
Thank you. Thank you, Anjum. Just a couple of other questions have come in. One is from Jamila Hassani from the Chamber of Social and Solidarity Economy from Mayotte. And the question is, how was the informal sector managed? Did it have any impact on civil society? Then Narayanan is asking, will post-COVID-19 reverse trends of globalization and urbanization? And Gomati Avasti is asking, is there any other options than lockdowns? Now, let me give some reactions to these questions, because some of them, I think the speaker and the panelists have answered. But there are a couple of major lessons which come out of it. One is the example from Sri Lanka. What is very well known is that Sri Lanka had the basic indicators of social development, which were as good as Korea's years ago. And it had, among other things, a very strong public health infrastructure facility, which the mayor was also referring to. So I think that what we do see in the other countries of the subcontinent is that there has been a neglect of some elements which are absolutely key for any anti-poverty program. One of them being the preventive health care, which is totally absent in many states of India and in Pakistan. But also what's interesting is the state of Kerala, which has very similar indicators as Sri Lanka, has also been as successful in managing COVID-19, despite getting all the, many more migrants coming back from the Gulf and so on. So one issue is that I hope with this and through INHAF, we are able to emphasize that you cannot have any country planning to become a $5 trillion economy if you don't have the basic preventive health care, which is universally accessible. The second thing which I'd like to point out is that, as Sanjay was saying, there are also really, it's a learning moment for our political leaders that, if you want to make your city livable, there are certain things which can be done without really that much of extra transactions costs. And, this whole idea that a livable city can be green, and it can also be one where basically the pedestrians control everything and not the cars, to make it much more pedestrian friendly than be, overrun by cars and air pollution, is an important theme which, while we all accept in passing during the lockdown, I think the general tendency is for the well-to-do people to say, okay, we can start driving our cars back and park anywhere we like, and basically take over the street. So here's an opportunity to change the dialogue, and also to bring in another form of governance. And Mayor, if you need any help from CityNet, we are more than happy to help out. And the same goes to Malaysia and other participants also, that there are ways in which it can be done. Because I think the point which Anjum made was, of course, that data allows us to draw conclusions which are not political. And as we know, all politics is local. And so everything becomes a question of for or against. But the interesting thing about the COVID experience is that I mean, we can't really question the data because it's right there staring at our face. And the same thing goes with the data we have of pollution, bad quality of life, poor health of the people. And of course, the big issue in the subcontinent is the fact that you've got such large populations of very poor with no access to affordable housing, and who basically were, despite all the protestations about empowering them, the reality was that they became the invisible force who were not helped by anyone. And there wasn't also the social mechanism like in Sri Lanka, where everyone would be institutionally given the kind of support they needed to survive in these very difficult times. So these are some of the observations I had.
Vijay, can I jump in?
Yeah, please.
For a quick comment. Firstly, Dr. Altaf, you're absolutely right in saying that the local peaks will hit much later, and I think the states and the districts in the states where people have gone back from the big cities they've had the time to prepare, and hopefully they will be prepared for those local peaks. Point well taken. Vijay, just to comment on the question on how has COVID impacted urbanization. There is a growing perception that public transport is actually contributing to the increase in the infection rate, which takes away the focus that more investment has to go in towards buses to carry more people, because people feel safer in traveling in their own cars and in their own private vehicles because they're not coming in contact with other people. But in the long run, I think there is a life cycle cost and life cycle impact on public health as a result of the change in focus. There is now a tendency to take your focus and take your eyes off public transport and invest the money, because the auto industry is now pushing the government to say that, look, allow us to sell more cars because it is safer for COVID. But this is a flawed argument. And I think this is something that has to be discussed in more detail. But to answer the question quickly, the impact of COVID is at multiple levels across all sectors. And only time will tell in the next 6 to 8 months what that impact will be and how do we manage the urbanization trend that is happening across major economies, but predominantly in the South Asian countries of India, Bangladesh, Pakistan, Sri Lanka, and Myanmar also to some extent. So let me stop there. Thanks.
Thank you. So let me ask Kirti to come into this question, which is from Chatura Velivithya. For Sri Lanka, traditions have helped us to prevent coronavirus. How can tradition in India also help to prevent the uncontrolled spread of the virus? Kirti, any reactions? Is Kirti on? If he's not, Anjum, would you like to answer that?
Vijay, I feel that, this is part of the communication strategy that
Sorry, you've gone off.
completely, different things. Just yesterday we had the amazing spectacle of the health minister chewing out the population, calling them stupid and ignorant for ignoring her order.
Sorry, you've gone off again. Kirti, would you like to come in? Anjum is off the mic right now. Kirti, you're unmuted.
I'm back.
Okay. If you're back,
Okay.
go ahead.
Yeah. What I was saying was, it makes sense to build on things that the people are familiar with doing. In that sense, yes, using traditions is very important. But aside from that, there's no other magic. One thing, Vijay, I would like to say is that going back to normal after the COVID, I'm less sanguine. I feel that if we continue to have a production system that is based on competition and profit, we will end up back in the same situation. We will still have these kind of workers on contract labor without any rights and stuff. So we have to focus. I mean, yes, the habits of people would change, but think of the 1918 pandemic, when just in India, 15 million people died. And I don't see really any change in the way things were. So we have to focus on the system of production. That has to change. So it has to, give a lot more power back to the workers for, other things to change. I mean, all this urbanization, traffic, work will only be affected if the system of production is changed in some meaningful way.
Anjum, Subanik Roy is asking, what is the difference between per capita case loads and per capita mortality between India and Pakistan?
Okay, Vijay, as I mentioned in the talk, the per capita measure is not a useful measure. I tried to illustrate it with that example of the big forest and the small forest. The infection is spreading at the same rate or at a given rate. And the fact that you have a much larger country doesn't change that. It only matters in the end when in the larger country you'll have more absolute number of cases and deaths than in the smaller country. But otherwise, it's not a useful measure.
Thank you. Partha Mukhopadhyay is asking, what was the extent of local city capacity in management, contact tracing, data analysis, etc., vis-a-vis other levels of government? Is there any role for civil society? Let me ask Mayor Senanayake on that. What has been the role of civil society in all this in Colombo? Is she there or? Mary Jane, can I ask you, what has been the role of civil society in the Philippines? Could you unmute Mary Jane?
I am now unmuted. Hello, I'm back. Civil society has been very active. In fact, I was about to mention that civil society is now getting ready on the problems of education and also economy. We tell people, let us now support more of the restaurants, the small restaurants, the small establishments. They need more customers. And then the other one on education, the Red Cross is now coming up with ways that if we come up with people, the students coming back, they have to wash hands, but you can't tell them to go to the lavatory. So as they come in, they should already be washing hands because we can't be affording giving alcohol to everybody. So we're now coming up with a drum that could be made into a wash hand stand so that as the children come in, they can wash hands before they come in, and we can come up also with thermal scanners. Civil society has been also very active in giving relief goods, but I would just like to bring up one thing on a part of civil society and the senior citizens. I would like to say that it is only during the time of COVID that I have felt discriminated against. because I belong to the senior citizens. And whenever they come up with regulations, they say, all right, people may now go out except senior citizens and minors. Senior citizens cannot go to malls and to market. Senior citizens, so I said, if I realize that senior citizens are more prone to disease, but then if you are a healthy senior citizen, we know better when you have a comorbid disease, but if you don't have any, why should we be discriminated against? So this is one of the things that I am lobbying against. So I said, let us treat senior citizens better. And the last, I would also like to mention that when we come up with, the role of minors, when you go into education on online teaching, we are only developing the IQs. Let us not forget, we need social interaction for these children. We need to develop their social quotient and their EQs, emotional quotient. So as we go forward, let civil society come in. Probably they can supply what the formal schools cannot. Thank you.
Thank you very much.
Vijay, can I come in? Because I understand you were trying to call me and I didn't hear you.
Yeah, my suggestion is, Kirti, why don't you do the closing comments and then we'll end this webinar.
Yeah, Vijay, can I come in on a comment that Mary Jane just made, please?
Hey, baby.
1 minute only. Because we are exceeding our time.
Thank you. No,
Baby.
quick response is, I think the question that Partho had raised on capacity at city level, what has also been quite a revelation is cities that had systems in place that they have spent years and years putting implementation mechanisms in place. Those cities have succeeded largely to containing the virus infection, rather than cities that don't have proper practices in place. A great example of Colombo. That's one part. There was other question on electric cars. I think the debate is still on. Electric cars still will lead to congestion on the street. You're just not polluting. And you may not be polluting there, you might be polluting somewhere else, because the energy that you use to charge your car might be coming from coal plants. So you're polluting somewhere else, but it may not be polluting in the city. So unless you're going to charge your electric cars from solar and renewables, then you truly are off the grid in terms of not polluting the space that your car is driving in, but also not polluting where the energy is generated from. So.
Thank you, Sanjay. Kirti, closing comments from you, please.
Well, I think, thank you very much. It was a remarkably very interesting webinar. And there is no way to kind of summarize everything, but let me see a few things that I think are very important. And I think number one is this, that this COVID has brought out very clearly the nature of our cities, especially in South Asia, that we could rethink the cities upside down on every conceivable way. The kind of crisis that we've seen of the migrant workers, they've really presented the kind of conditions in which people are living. We had known earlier slums, we had known earlier other form of accommodation. We know we are still keeping a large number of people in this kind of conditions. We've got to also think that if you're talking about something like 820 million people living in cities in 2050, that is just 30 years down the line, we are just not prepared. Our cities are not prepared to allow them to come in, to live properly. It also becomes very clear that you can't keep such a large number of people in the conditions in which they are in our slums. You can't really have 60 people sharing a water tap and 30 families sharing, a toilet. Now, these are very important issues of investment, important issues of planning, important issues, in terms of how do you manage our cities, because if cities are our future, these are very important considerations. And COVID has really kind of brought in opportunities to think about, to reflect, to think of new institutional responses, and really kind of move ahead. And therefore, I think it's not only an important call, it's an important kind of a new direction that we should take in terms of how we develop our cities, what do we do with them? Because a large number of people are going to be there. We don't have much time. We've got to rethink our governance. We've got to rethink our investment. We've got to rethink our priorities. Thank you.
Thank you very much, Kirti. I think we've reached the end of our session. So let me thank the principal speaker, Dr. Anjum Altaf, Mayor Senanayake of Colombo, Mary Jane from La Union, and Sanjay from Bangalore for all their very wise comments and insights. I think we've learned a lot today. Then clearly there's a lot more which we can do in the future. And from the side of CityNet, we are there to help any city which wants to, any kind of technical assistance or support to try and come up with a new vision and to take advantage of these terrible times we've had over the past few months. Because I think every crisis also offers an opportunity to do things differently. And so with those remarks, thank you once again, and be safe, and hope we can see you again in another seminar. We are continuing to have these COVID seminars from different parts of Asia so that, we get an idea of what different cities are doing. And we will hopefully see you again and collaborate with the collaboration with INHAF will continue. Thanks once again. Bye-bye.
Let me also thank on
Thank you,
behalf
Dr.
of
Vijay.
INHAF,
Thank you to all the
CityNet, and
panelists.
everyone.
Thank you.